the leadership of the Ministry of Health here in the state of Telangana, the Department of Health here in India, and the RNCP leadership. Ladies and gentlemen, warm welcome to the closing ceremony of our 50th World Conference on Lung Health. It's been an amazing few days here in Hyderabad. We have come together as one union to share experiences, ideas, and to learn from each other. We have connected and renewed networks with friends. We've made new friends. We have discussed new ways of collaboration. We have started to develop new research networks. And I am convinced that over the years, many of the things that have happened in this conference over the last few days will bear fruit for the union and for the people that we serve. It's been a great few days of science. We have had some significant advances in the diagnosis, treatment, and prevention of tuberculosis. We have also heard how to handle some of the new challenges that the union is facing, air pollution, asthma, COPD, and others. We have heard extraordinary stories from survivors and civil society partners. We have seen renewed energy to campaign for the rights to access to medicines and people-centered health services from around the world. These things are extremely satisfying for me as an individual. And I think it is a befitting end to my presidency as of the union. I feel very privileged to have been part of this wonderful movement, which embraces scientists, doctors, nurses, governments, industry, advocates, and activists, all united with one common goal: to free this world of TB and the devastating consequences of lung disease. It's been very enjoyable, but also very challenging to be the president of the union over the last 3 years. But in those 3 years, I have seen a greater commitment by the TB community to move with a faster speed to end the TB emergency, and that science, leadership, and action is needed to be able to bring us to that goal. We have learned that we need innovation, we need new treatments that are effective, accessible, and acceptable to our patients, and that do not cause side effects. If you will remember what happened in the first session when we were opening this conference a few days ago. Last year, governments made commitments at the UN high-level meeting on TB to end TB by 2030. And we need to keep making our governments accountable to fulfill those commitments. We also need national strategies that are properly resourced and prioritized, and we are privileged to be in India today that has committed to make itself the leader in that process of getting us to end TB. They have promised to show us the way on how that can be achieved and how this world can rid itself of TB. At this critical moment, the union is needed more than ever before as a facilitator as well as an agent of change with a powerful, independent, and collective voice. Yesterday evening, as you all know, at our General Assembly, I formally handed over the baton over to my successor, President Professor Guy Marks. I have great confidence that this good ship that the union is in fact in very good hands. Professor Guy Marks is very well known to you, or to many of you. He has a very deep knowledge of this organization and its membership and its programs. He has a passion for excellence and a clear vision of how this union should be governed as the union embarks on an exciting new strategy for the coming centennial year. I'm sure you will all give the board and leadership the full support that it needs. And again, I thank you, all of you, for your encouragement and your support. I now have to do that thing that most of us don't like doing, which is handing over to Professor Guy Marks. I'm leaving you a very nice boat. It's actually sailing very nicely today. And 3 years down the line, we'll hold him accountable in case. But I'm sure, I've already told you, the union is in pretty good hands. Thank you very much for agreeing to take over the mantle of leading the union.
Wait, there's Chakaya. So, yes, Chakaya is very happy. I'm a little anxious. Before I do anything further, Chakaya said a number of very nice things about me, which are hugely overstated, but nevertheless, I'm very grateful to that. But what I'm more grateful to him for is his leadership over the last 3 years. I've had the privilege of sitting in the Bureau and on the board with Chakaya over that 3-year period. I've seen a man of huge integrity, passion, and commitment to solving the problems of tuberculosis and lung disease and of furthering the mission of the union. He's a man of wisdom and great calm insights into how people work, how organizations work. I've learned a huge amount from him about management of organizations, about running of boards, about the way to get things done and the way to solve problems. And I'm immensely grateful personally for my learnings from him, for being mentored by Chakaya, but also on behalf of the union, I'm immensely grateful for the huge contribution that Chakaya has made. So I would like to take the opportunity to thank him. And you're not getting away without some gift. So here we are. So I think we probably got a stand for a photo. No? Yeah, I've got a photograph. Oh yes, here we are. Thank you. Thank you very much, Chakaya. The print is very large on this script, but I still need my glasses, so you have to bear with me. In recent years, we've sought to include more representatives from civil society, activists, advocates, and survivors. Our Community Connect program and Survivors Summit have been highlights of this conference. In this context, I'm delighted now to welcome 2 TB survivors and activists to give their reflections on the conference and the road ahead. These are Ingrid Sherman of TB Proof, South Africa. Ingrid has just been re-elected as a member of the board. And Maureen Murenga of the Lean On Me Foundation in Kenya. So I welcome them to the stage.
Thank you. Hi, I'm Ingrid Skuman from TB Proof in South Africa. XDR TB nearly killed me. I developed liver failure because of the toxic treatment side effects, and I was in a coma. I ended up spending 75 days in hospital, but by God's grace, I survived. I had access to excellent medical care. But to be honest with you, I felt like giving up. I really respect the majority of people in South Africa and across the world who often don't even have food on the table to eat, yet they fight with heart and soul to get cured of TB. We were all moved by Nandita's story yesterday, a young journalist losing a hearing due to treatment side effects. Her story is a constant reminder that we must do better. We have to increase the quality of TB care and really provide person-centered care. So the question is, how do we do this? The TB Survivor Summit, Community Connects Space, and the Scientific Conference, amplifying voices of people affected by TB and lung disease. And then for researchers and policymakers to take responsibility to hear our voices and to implement our recommendations. Then to ensure that equal value is given to an affected community member, the same as any other key stakeholder, because we are also experts. Research protocols, national strategic plans, and policies should never take place without input from civil society. Then it can be effective. In the past, there has been a bit of a tension between a public health approach and a human rights approach. And I think it is important for us to remind each other that they are not opposing, they are complementary. So thank you to the union for bringing us all together. And let's continue these discussions and prioritize effective community engagement, because together we can ensure person-centered, high-quality TB care. Thank you.
Thank you very much, Ingrid. That was quite powerful. And it is quite a very sane moment here that we are now coming to the closing of the conference. We came, we saw, we shared, we learned, we ate. Some people had an opportunity to go dancing. And now we are here. And I think at the end of the day, people will receive the evaluation reports and they will give their comments. Most of them will be positive. And we will call it a successful conference, which is a good thing. Most of the things we have seen here in this conference, there's been quite a lot of changes that we need not to miss, even as we are leaving this space. Like Ingrid talked about the Community Connect. I was a little disappointed that I didn't see many people from the NTP, the National TB Programs and the Ministry of Health joining the conversations at the community level. You missed quite a lot. You missed such a huge opportunity. But that's not the end. I'm sure the next conference will have an even bigger Community Connect space, and we will have all of you coming to join us, because it's a space for everyone. We all form a community, and it's important that these voices also be in one room and speak together. All is so good so far. What would be disastrous is refusing to be agile and adaptive in this type of change that is happening. We've seen new ways of working that have been shown in this conference. We have seen innovation. We have seen new products. And we have seen a lot of paradigm shifts. We have seen how the world has acknowledged that we cannot defeat the epidemic of TB without engaging affected communities and the civil society. With this acknowledgement, we are headed towards the right direction. So we are hoping that when we go back, we will review what we are doing and have those changes happening at country level. We will put to scale what works, we will change what doesn't work, and we will remember to revise the punitive laws and policies that hamper access to services, because TB response is about the people. Thank you.
Thank you so much, Ingrid and Maureen, for sharing your experiences with us and reminding us why TB survivors and have so much to contribute to helping to end TB. I'm now going to give some of my reflections on my thoughts about the union. It'll take me about 10 minutes, so I hope you'll bear with me. I wanted to start by saying it's a great honour to be elected to serve as President of the Union now in its 100th year. I am truly deeply humbled by the trust that's been placed in me and by the company into which you put me by electing me to this position. During my term on the board, I've worked with Presidents Alsmer Elsoni, Bertie Squire, Jane Carter and Jeremiah Chikaya Mua. All of them have served with commitment, dedication, integrity and dignity, and all have left the organisation in better shape than they found it. Many other outstanding leaders before them have done the same. I only hope that I can do justice to the mantle that's been handed to me, and at this time I would like to share some of my thoughts about the road ahead. I'd like to start with the question, what is the essence of the union? Many people find this a difficult problem. The union is a very complex organisation with a long and distinguished history, during which it has experienced many vicissitudes and undergone many changes. Currently, we are undergoing major changes in response to a rapid evolution in our funding environment, and linked to that, we're engaged in a strategic planning process designed to renew our sense of mission and to clarify our aims and the modalities for achieving them. I do not wish to make any assumptions about the outcome of that strategic planning process. However, I do want to say something about what I see as the core enduring features of the union. First, we are about reducing suffering due to tuberculosis and lung disease. This involves better prevention for those not yet affected and better care for those who are affected. It is this that brought the union into existence, and it is for this that the union continues to exist. The burden of tuberculosis and lung disease remains vast. It affects people at all stages of life and in all corners of the globe. Tobacco, air pollution, workplace exposures continue to be major threats to lung health. There is much work to do to reduce suffering due to tuberculosis and lung disease. Second, I would say we are about the generation, dissemination, and implementation of knowledge into policy and practice. In these times when we hear a lot about fake news, the value of science, and indeed the value of truth, is under enormous threat. And our work in promoting and sponsoring research, building research capacity, conducting conferences, publishing journals, providing technical assistance and expert consultations, developing and disseminating practice guidelines, and advocating for evidence-based policy becomes all the more crucial. Through it, we demonstrate and reaffirm our unswerving commitment to science and knowledge as the basis of policy and practice. Third, I would say we are about justice and respect. In using the word justice, I intend fairness among and between individuals and among and between communities. By respect, I mean a recognition that all human beings have an intrinsic value and that regard should be had to the interests, belief, perspective and customs of all. Justice and respect have always implicitly guided the union's work, but it seems to me important that we are now explicit about our dedication to those values. We must do everything in our power to ensure that no one is left behind, that resources and opportunities are fairly shared, that colleagues, patients, staff and the general public are actively and respectively engaged in the matters that affect them. Fourthly, a defining feature of the union is that we are a membership organisation. Our members are organisations and individuals from all parts of the world. We are made up of governments, charities, professional groups, patient groups, civil society organisations. We bring together doctors and nurses, allied health workers, health service managers, scientists, patients, advocates, and members of the general public. We connect and unite students and professors, interns and consultants, clinical assistants and hospital directors. The union's richness and diversity, its past achievements and its future potential lie with our members. So having reflected on those four essential features of the union, what are our major challenges that we face now? I want to highlight some of the principal challenges as I see them. I'm going to mention four. The first is money. While this is a perennial issue, there are major changes in our funding environment which mean they take on a particular urgency today. We are particularly vulnerable to the adverse effects of these changes because our business model has been configured to depend heavily on donor-funded project work. Rethinking that model in a way that will enable us to escape from deepening debt and deficit is our first major challenge. A second challenge, it seems to me, is to shore up and recommit to the union's reputation as the leading voice on tuberculosis and lung disease. Prior to the 1990s, the union was the sole global organisation with a focus on tuberculosis, albeit with the support of several major national organisations such as KNCV, JARTA and others. Since that time, WHO, the Global Fund, Stop TB Partnership have all entered the field, and many international NGOs and charities are likewise active in TB care and in lung disease. This is, of course, to be welcomed, but it is for the union to exercise thought leadership on tuberculosis and lung disease. We must ensure that our activities in the sphere of project implementation do not distract from this aspect of our historic mission. A second challenge, then, is to rededicate ourselves to global leadership in the field of tuberculosis and lung disease, and to redouble our efforts to put the union at the vanguard of relevant ideas, initiatives and developments. The third is the challenge of growing and engaging our membership. Tuberculosis and lung disease affect large numbers of people throughout the world. Likewise, tobacco, air pollution and hazardous workplace exposures are serious and ubiquitous problems. It follows that there are many potential stakeholders in the business of the union, yet only a small minority of them are members of the union. We need to change that. The union should be a union of all affected groups, whether healthcare workers, patients, the general public, community, government agencies, donor agencies or civil society organisations. We need to make it into an organisation that is truly representative and truly global. A fourth and final challenge I want to underline is that of strengthening our conference and journals. These aspects of the work are pivotal to the union's role in knowledge exchange and dissemination. They are our most conspicuous contribution, our public face. Indeed, for many people, they are the union. We are proud of them, but there is room for improvement. We need to make the conference available to a wider audience by strengthening regional meetings. We need to think creatively about the process of knowledge exchange and dissemination and adapt our practices to better achieve those goals. And we need to be vigilant in maintaining the quality of the journals to ensure they retain their authority, influence and impact. So, what about the way forward? The way forward is something that needs to be worked out collaboratively, and there are no simple answers to our problems. Nonetheless, I want to refer you to some initiatives and ideas that may be pertinent as we frame our approach to the challenges that we confront. The first is the strategic planning process. The board and the executive management team have commenced a strategic planning process with the aim of developing a framework for the union's operations over the next 5 years. We first seek to define the union's values and recommit to its vision and mission. We are consulting widely with stakeholders about these, and you'll soon receive an email survey about this. On that basis, we're assessing our internal and external environment in order to identify the strengths, weaknesses, opportunities and threats that influence our ability to achieve our purposes. The next stage will be to elaborate a set of strategic goals that will guide us towards our mission and help us stay true to our values. Finally, an implementation plan will be drawn up to achieve these strategic goals, along with a monitoring framework designed by the board. The next is a business model, a new business model. It'll be evident from what I've been saying about changes to our funding environment that a new business model is urgently required. Our Executive Director, Jose Luis Castro, together with the executive management team, are very well aware of this and are currently engaged in designing and implementing a business plan that will shift the focus somewhat away from the donor-funded environment, donor-funded project environment, towards activities that realise the inherent value of the union brand, such as the conference, courses and philanthropy. The new business plan will also place a greater emphasis on growing membership. We'll hear more about this in the near future. The third area in which I would propose that we should work is in leadership on tuberculosis and lung disease. These are exciting times for those of us working on tuberculosis and lung health. There exists a substantial global momentum towards TB elimination and the solution of many lung health problems that we face. The Union has a role to complement this energy with strategic leadership. At the Union, we count among our members many of the world's most distinguished scientists, clinicians, public health practitioners, advocates and policymakers in this field. We can and must provide that strategic leadership. As indicated earlier, I believe that it is time to reassert our role as the principal global forum for informing, influencing and shaping efforts in the sphere of tuberculosis and lung health. Finally, we need to move forward with improved engagement with membership. My predecessors as President have placed great emphasis on improving engagement with membership, and I am gratefully following their lead. Chikaya introduced the concept of one union, by which he meant that members and the Institute are not separate entities, and that the scientific sections and the regions are all part of one organisation. The next step is to make membership of the Union more rewarding and meaningful. This is already well underway, with activities such as webinars organised by the TB section, improvements to the conference, which you've seen here, and the appointment of 2 new editors-in-chief of the IJTLD. The revitalisation of regional conferences and the engagement of membership in the process of strategic leadership in tuberculosis and lung disease will be further important steps. We need to actively consider additional sustainable plans for improving the membership experience and giving further stakeholders a reason to join. So how do I see my role? If these reflections seem rather general, I would say in conclusion that this is deliberate. The President of the Union in some senses is simply the Chairman of the Board of Directors. I hope to be able to take a helicopter view of the organisation, to ask questions, to raise issues, to promote initiatives, and to provide advice when asked. I hope to be a conduit facilitating communication between our many and diverse stakeholders. In doing so, I will be keen to hear from members, consultants, patients, donors, staff, and anyone else who wants to talk to me about the Union. It is an immense privilege to serve as President of our remarkable organisation, and as I embark on my term, I want to express my thanks to the Board for giving me this opportunity. I follow in the footsteps of some exemplary leaders, and I'm absolutely delighted, if not a little daunted, at the prospect of being able to continue in this new capacity to the effort, contribute in this new capacity to the effort to tackle the problem of tuberculosis and lung disease worldwide. Thank you very much. Now it gives me great pleasure to invite to the stage a good friend of the Union and the person who is in charge of the Indian government's revised National Tuberculosis Program, the Deputy Director General, Central TB Division, Ministry of Health and Family Welfare, Dr. K.S. Sachdeva. Thank you.
Dr. Chakaya, Dr. Guy Marks, distinguished members of the Union, ladies and gentlemen. It's my proud privilege to be here at this conference, to meet many of you. I've also been able to take part in some of the deliberations. Like they say, all good things must come to an end. The Union Conference comes to an end after so long, and I congratulate the Union on the success of this conference. I know many members have been actually wanting that the conference must come to India, and it has come to India at a very opportune time. India has committed to end TB 5 years ahead of sustainable development goals. We at India have made some strides in its progress towards end TB in the last few years, but they are modest. We would like to intensify our efforts and actually lead the way the TB control is carried out in the world. Through our efforts, we have been able to show a 16% increase in TB case notification last year. We have also introduced all oral regimen in few of our provinces, and I hope to take it to scale by first quarter 2020 in the entire country. We are also investing in the community, you will be happy to know, and we have actually constituted district TB forums in all the districts of the country. As our Prime Minister has committed to end TB by 2025, we also, from this podium, commit that we will accelerate our efforts to bring down the incidence, accelerate the decline in incidence, make major investments in various strategies, and with the support of all of those present here and other national governments and other countries, we will make the world TB free. I also put on record the excellent contribution which Union has put in our country in supporting the National TB program. Particularly the leadership of Union at India, Dr. Jamie Tonsing, Dr. Imran, Dr. Subrat. Their project, Aksha, has enabled the program to reach 2 million hardest of the people, which are very difficult to reach. They've also, through the Challenge TB project, brought various stakeholders together, specifically scale up of private sector, civil society, through their Call to Action project. And as Guy Marks was asking me, we will work together, we'll continue to work together with Union and all other stakeholders to take this initiative forward. Our political will be matched by resources, energy, and innovations, and we look forward to support of all of you and in a partnership mode. Let's work tirelessly to work this epidemic in India and all over the world. Thank you very much.
Thank you very much, Dr. Sachdeva, and thank you for your leadership on tuberculosis in India. We have been very privileged to hold the conference in the city of Hyderabad, and we've received tremendous support from the state of Telangana the Convention Bureau, and the Chamber of Commerce. I must also thank Dr. Rajeshan, the State TB Officer, and his team, as well as the Police Commissioner for his support in organising field trips for the delegates, visiting TB facilities, and tobacco control law enforcement. Now I'm delighted to introduce Mr. B.P. Acharya, Special Chief Secretary of the Government of Telangana and Director General of MCR Human Resources Development Institute. Welcome to Mr. Acharya.
Professor Guy Marks, past President Jakaya, Dr. Sachdeva, distinguished delegates attending this conference in Hyderabad, ladies and gentlemen. On behalf of the state government, I would like to congratulate the Union for a highly successful event which you conducted here today, the 50th Conference of the Union. As you enter the 100th year of the Union, this is a very happy augury. And if I may add, as Dr. Sachdeva mentioned, it's a very timely event for India. All of us have seen how the national capital is struggling with the smoke cover, the smog all around it, and how the air quality index has dipped to the all-time low. How India is battling in what is kind of a climate crisis. That is where such events create awareness among all concerned. And the Union, as I understand, is a very unique body of professionals, of doctors, of scientists, of civil society, of the NGOs working. Ladies like Ingrid and Maureen who are doing tremendous work in their respective countries. There's a need to collate all these efforts. We don't need to be in islands of each one's excellence. We need to put everyone together, break all silos to fight this menace. This is particularly important for a country like India, which has the highest burden of TB, as per the data that I have with me in the world. Every year, we have incidents of 2 million new cases being reported, nearly 2 million, of whom nearly 0.2 million die every year. That's a very grave and alarming thing that all of us need to ponder over. How is it that we put all our efforts together to see, and platforms like this provide an ideal opportunity for the brainstorming and to plan out strategies for future. I once again compliment the Union for doing excellent work in this field in creating awareness. Such a conference, I was told, was held nearly 60 years ago in India. So the conference has come back again to India. It's a very happy thing. And the Hyderabad Convention HCBB Visitors Bureau, Dr. Gary Khan and Prabodh from Delhi, who worked tirelessly to make this event happen. We from the government are proud to host this event and to lend whatever support we could to make this a successful event. I hope all of you had a pleasant stay in Hyderabad, a city which is known as a fusion of cultures, which represents the best of the north and the best of the south of India. Is a melting pot of different cultures and ideas. This city would have given you time to go around and flavor we call it the Ganga Jamni Tehzeeb of Hyderabad, the confluence of cultures of Hyderabad. I hope once again you'll have chance to have a conference like this. A couple of years ago, we had a world conference of the infectious diseases in Hyderabad with the help of HCVV. This is, in a way, a happy sequel to that we're having the Conference of the Union. I wish all of you a safe journey back home and hope to see you again in Hyderabad sometime later. I would end with the invocation from the Vedas, which wishes for the good health and the happiness of everyone. Sarve bhavantu sukhina, may everyone be happy. Sarve santu niramaya, may everyone be healthy. Ma kasjit dukkha bhag bhavet. May no one be unhappy. May no one suffer from any illnesses. Om Shanti, Shanti, Shanti. Thank you very much.
Thank you very much, Mr. Acharya. And as I said before, the city of Hyderabad and the state of Telangana have been wonderful hosts for us. But now we won't be back here next year, we'll be somewhere else. And so where do we go next year? Now I'm proud to announce that the venue for the Union World Conference for 2020, our centennial year, will be Seville in Spain. Please welcome to the stage our partners from the Seville Congress and Convention Bureau, Jesus Rojas, Maria del Mar Canero, and Jane Corrales. You will note that I now have the opportunity of moving from mispronouncing Indian names to mispronouncing Spanish names, but that's a lot of Australians. Okay, so I think my last task is really to thank you again to all the delegates and to officially declare this conference closed and look forward to Seville 2020 and then to hand on to you to tell us about Seville. Thank you.
Good afternoon, everybody. Distinguished authorities, local and national from India, distinguished members of the boards of the Union, and I want to introduce you just a part of my team that they are expecting in Seville, anxious to celebrate this conference next year. And we are very proud to receive the responsibility to organize this special conference in Seville. First of all, because it's a centennial, it's 100 of year of the Union, with the great level that is making for the world and from the health all over the world. And we are talking also on behalf of the Mayor of Seville, the Ministry of the Regional Institution, the Regional Government of Andalusia of Health, and also the Ministry of Health of the National Government of Spain. Why in Seville? I think that, first of all, we want to introduce you with a short video that you will have an idea what Seville is. Seville is a small city, well, not too small, it's 700 inhabitants. It's in South Spain, and we have more than 300 days during the year of sun, and you will like. So if we can pass to a short video now. Well, did you like it? I hope so. Trust me if I say that it's better going to Seville than leave it Seville. Once you are in Seville, it's very difficult to find. It's almost the same that we have feel here in Hyderabad. It's a discover another city. We know that will be very hard for us to do this, I think to do better than Hyderabad with this conference that we have celebrated this year, but we are sure that we are able to do. Why Seville also? In Seville, 1,000 years ago, in the Middle Age, there was a physician, poet, Muslim, because in that years, Spain was Muslim. A physician called Abensoar discovered for first time and diagnostic the intestinal tuberculosis in Seville. That was 1,000 years ago. Some centuries later, 100 years ago, there was a doctor, Pedro Ballina, that opened in Sevilla the first sanatorium for fight against the disease, delivering free treatment to those patients that could not afford it. That is very important in the history of the medical history of Seville, because we must pay tribute to these pioneers that contributed such extension to combat the TB in Sevilla. Sevilla is also the capital of Andalusia and has full autonomy of health, not depending from the national government from Spain, and based the quality, the health in Seville is based on the integrated care processes that to treat the TB, AIDS, and other infectious diseases. Also, Sevilla is integrated in the 2030 agenda for the sustainability, and is very integrated in health also in the politics on the strategy of the local, regional, and state national government. And that policies affect to the tobacco regulation, their quality, waste management, the reduction of the CO2 emission, and the mobility. That is one of the most important things that we have about the contamination of the air. For ending, because we have watched an specimen about what you can find in Sevilla, but Sevilla is also the people, is a lot of mix of cultures that pass through the city. So that's is present always in the people, in the gastronomy. In the Sevilla is also like a museum where you can find in every corner, in every street, a monument like churches, like historical monuments from Romans, from Arabian, from Phoenix. So it's a lot of cultures. But one of the things that we want to give you now here is a connection between India and Andalusia and Spain. Probably few people knows that many of the cultures that arrive to most of the countries all over the world, and one of them is Spain, is the flamenco. Sevilla is also the cradle of the flamenco. You know that the flamenco is now a treasure of the humanity, immaterial, of course, but it's a treasure of the humanity. And in its origins, most of them came from India. Now we are going to obsequiate you with this performance, where you will find this connectivity between both cultures, and is like representing that we are only one in the world, and all the cultures of the same place. And I think the fact that what are making the union of serving the health, and not only the health, the humanity to every corner of the world, is very important, and we are very proud that next year to have in Seville. So just save the date, don't forget, we will wait for you in Sevilla, and hope to say personally, my team and I, hello next year in Sevilla. Thank you very much.
How's it going? Good? Ole.
Din tak tita kita ta 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 din tak tita kita ta 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 din tak tita kita ta 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 din tak tita kita ta ta. ta din dhan ta tin tin. Dhan ta din dhan dhan din. Dhan ta din ta din ta din ta. Takita 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 ta da. Takita 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 ta da. Da 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 takita da 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 takita da 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 takita da 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 takita da. Rat tat 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 takita takita da. Rat tat 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 takita da. Tay ta tay ta tay takita takita tay ta tay ta tay takita takita tay. Rat tat 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 takita takita da. Tay ta tay ta tay takita takita tay ta tay ta tay takita takita tay. Takita takita tay takita takita tay takita takita tay ta tay. Takita takita tay takita takita tay takita takita tay ta tay. Takita takita tay. Thank you.
Yes.